Good morning, everybody. As you know, my name is Wellington Chiriboga, and the topic of today that we are going to talk about is the anti-lymphocyte globulin for prevention of chronic graft versus host disease. A chronic graft versus host disease (GvHD) is a major compilation of allogenic stem cell transplantation that results in later illness and death and a reduction in quality of life. Our first video is here.
As you learn about or plan for a blood or marrow transplant, your transplant team will help you learn about GvHD. GvHD stands for graft versus host disease. Learning about GvHD and knowing the signs and symptoms to watch for can help you be more prepared for your transplant recovery. What is GvHD? GvHD is a common side effect of an allogeneic transplant. An allogeneic transplant uses healthy blood-forming cells, also called stem cells, donated by someone else. GvHD develops when your new donated cells do not recognize your body, and as a result, your body is attacked by your new cells. GvHD can range from mild to severe, or in some cases, it can be life-threatening. GvHD may be temporary, or it may be a disease that you continue to have long after transplant. If you develop GvHD, your doctors will provide treatment and help ease your symptoms. There are things you can do to lower your chances of developing GvHD. The first tip is to take your prescribed medicines and to continue taking them even if you feel healthy. The second tip is to be alert for any warning signs and tell your doctor about any changes in your body that you see or feel. Your transplant team will give you a list of signs and symptoms to watch for. Sometimes primary care doctors or hematology-oncology specialists may not know the symptoms of GvHD. It's important for all your doctors and transplant team to talk to each other and share information about your health. If you're concerned about a new symptom, it's okay to ask your doctors to check in with each other. Your health is their top concern. The third tip is to avoid exposure to the sun. The sun's UV rays may trigger GvHD or make it worse. If you go out, make sure you always wear a hat, sunglasses, long sleeves, and pants. Also apply SPF 50 sunscreen to all exposed skin. You may also want to wear SPF clothing for added protection. And always remember that the sun on a cool and cloudy day can be just as damaging as on a hot and sunny day.
Now we have the applications in medicine. In this, we can look that it may have a better prevention of chronic GvHD and randomized studies of therapies aimed at reducing the incidence of chronic GvHD. Our second video is playing now.
Allogeneic hematopoietic stem cell transplantation is a widely used treatment for leukemia and other bone marrow disorders. In patients who receive this therapy, chronic graft versus host disease is a leading cause of late morbidity and mortality. Researchers hypothesized that giving anti-human T lymphocyte immunoglobulin, or ATG, as part of preparation for transplantation would decrease chronic graft versus host disease. But would it result in more infections and relapses? In this prospective multicenter study in patients with acute leukemia, 161 participants were randomly assigned either to the standard myeloablative regimen or to the same regimen plus ATG at a dose of 10 milligrams per kilogram of body weight for 3 days before undergoing allogeneic peripheral blood stem cell transplantation from an HLA identical sibling. After 24 months, the incidence of chronic graft versus host disease was 68.7% in the standard regimen group and 32.2% in the ATG group. The groups were similar in rates of relapse, infectious complications, and overall survival. The fact that relapses and infections were not increased with ATG was a happy surprise, since it was thought that reducing T cells with ATG might also lessen graft versus tumor effects and make the patients more susceptible to infection. The authors conclude that the addition of ATG to the standard myeloablative regimen before allogeneic transplantation resulted in a significant reduction in chronic graft versus host disease without increasing infections or relapses. Full trial results are available at nejm.org.
As always, we have pros and cons. In the pros, we can see the lower rate of chronic GvHD than the rate without ATD, and prevention of chronic GvHD. And cons. Risk factors for chronic GvHD are the use of peripheral blood as a source of stem cells, an history of acute GvHD, the use of innate stem cells with high numbers of these cells.
My name is John Galvin. I'm one of the stem cell transplant doctors. My role is to see patients prior to transplant, help them through transplant, and afterwards as well to help manage any type of complication. GvHD is a complication that can happen after a transplant. It stands for graft versus host disease. The graft is a fancy word for donor cells, and the host is the patient cells. After the donor cells find their way and grow in the host or the patient, they can start attacking the host in places that it shouldn't be attacking.
I was aware of that GvHD may happen. I didn't know exactly what could happen to me. That's why I was watching closely to all the new symptoms that I was developing.
So graft versus host disease likes to attack certain parts of the body. The most common parts of the body that it involves would be the skin, and that can be anywhere from a small rash to covering most of the body with a rash. It can involve the gut, it can involve the mouth, it can involve the liver, and different forms of it can involve the eyes as well.
My graft versus host was mild. I had a red rash all over my body, but that was pretty much it.
I really didn't experience any real bad GvHD. Yes, I had the burning of the hands and feet. Yes, I had stomach issues for a little while, but those passed.
I had a bad GvHD in my lower part of my stomach and the gut, which means I had to run to the bathroom multiple times a day. I also have GvHD in my mouth, which is a lot of mouth sores and tongue sores that are very painful. And lately I developed GvHD in my skin and in my eyes. So I had different types of GvHD, but they all can be taken care of with proper medicine. And if you just see the symptoms on time, you talk to your doctor and they give you a very good answer to what to do and how to take care of it.
And finally, the conclusion: if the study is well improved in every type of transplantation, the patients are going to have a less percentage of failure in the transplant. Thank you so much. That's all for today.